Good afternoon, welcome to a special edition of Mead Live. Today we are running the Innovation Live Healthcare Challenge. I'm joined today by a panel of UAE healthcare experts. Daniel Whitehead, you are from Dammam Health Insurance.
We take our role as the steward of government funds quite seriously. We try to use data, to use innovative ideas, to understand how that money is being spent, to ensure that it's spent efficiently, and also to make sure that it's spent on getting value for the money.
Prasant Mangat, you're Chief Executive Officer of NMC. Now, NMC is one of the world's big private healthcare providers, but you have a huge history in the UAE, 44 years. What's driving your activity at the moment?
So to give you an idea, that NMC has been in the UAE from 1974. Today, NMC is well spread among around 9 countries, not only in UAE, the entire GCC we are in Europe, in Spain, Italy, Denmark. We are in South America, in Colombia and in Brazil.
How good is healthcare in the UAE at the moment? Where are the strengths and weaknesses?
I'm somebody who has been involved in the healthcare industry for some time in the UAE, and I'm very proud to say that the journey of UAE in the last 10 years, from 2007 to 2017, has been amazing. The way in which regulator like Health Authority of Abu Dhabi, Dubai Health Authority, DHA creation, insurance company like Dammam coming in, the mandatory insurance rolled out in Abu Dhabi and Dubai are all are real milestones in the entire healthcare industry.
What are the innovation areas that you are looking at? So artificial intelligence, big data?
Yes, so we're talking about the innovation strategy. So we focus on certain areas. One of them is artificial intelligence, of course. So we need to develop algorithms that can support even consumers to do the first gates of healthcare. So instead of going to hospital directly, we get some sort of an app that can support you.
For any innovation to become feasible, it has to have a financial advantage of it. How can you reduce the cost? So reduction of cost is indirectly reducing the healthcare spend of the insurance company. It makes for regulators to understand, and identify how can we improve. So those ideas today are coming up from the world. So we are looking east, looking west. Both policies are going on from our side.
This cultural change, I think, is the kind of part of the innovation story from the user end as well as the delivery side.
Right.
Will these apps, will people trust them?
I think what the regulator's interested is to make sure that if somebody goes for a second or third opinion, they've been referred, right? That or at least that there's a good medical reason for it. Many people visit multiple doctors because they don't have confidence, or they're just worried, right? Maybe they shouldn't be. So telemedicine is one good intermediary here, which might help assuage some of that concern. So they could call a doctor. It doesn't cost the same as a physical consultation, but maybe it could just assuage some of their fears. The doctor can give them the referral if they need one. So it's about looking at other ways to structure the process.
Every patient will need to get better or a second opinion. This is very natural. I think, as I told you, eHealth can support this process. So it's about making it much easier, much faster, much effective. Also, by having what we call the 360-degree view of the patient data as a whole, it will give even the doctor a better, decision about whatever diagnosis that's required. So, because I'm sure that the doctor sees whatever data around me, he will make a better decision.
Today we have too many streams of super specialisms, something like even dentistry, you walk in, you will have 18 types of specialisms happening in dentistry. So patient is completely sometimes confused, which is the specialism I need to walk in. And then that specialist is really focusing on that particular knowledge that he possesses. So maybe a general holistic view will come from Unified. A primary care family physician who handholds may emerge out of it, which will definitely reduce the cost of provision of healthcare and make it more available for the people.
Excellent. Well, that's a perfect note to end on.